This year, Every Woman, Every Child is celebrating 10 years, and it's launching a 2020 progress report on the global strategy for women, children, and adolescent health. And I have gone through the report, and it has really good comprehensive data and progress on record. And this is before the COVID-19 pandemic. And you are a co-author of this really, really important report. What are the key takeaways for you from this report?
I think the main takeaway from this report is we have done immense progress, but it's still not enough, especially given that the progress has been for many, but not for all. For example, while globally the number of maternal and child deaths have gone down tremendously, 82% of child deaths and 86% of all maternal deaths are concentrated in Africa and Asia. And for neonates, decline in death has been quite slow in comparison with older children. Another example is treatment with oral rehydration solution for diarrheal disease in young children. In some countries, less than 50% of the children receive this simple life-saving intervention. Also, access to early childhood education continues to be a global challenge. And now COVID-19 has come to shake the entire world, including the health community, disrupting health services, which have impacted women, children, adolescent health. And persisting challenges have now been exacerbated, exposing failures in social, political, and economic systems. It's now more important than ever to protect the progress made to date. Recovery from COVID-19 will require multilateral and coordinated action across sectors, continued investment, and good data systems, to name just a few.
Wow, thank you very much. I think that's a good list of where we need to start from. But I think for this interview, I am really, really keen to hear your thoughts on how we can facilitate partnerships between governments, multilateral organizations, civil society, the private sector, and all the stakeholders that we need, even as we look at the health and well-being of women, children, and adolescents. Because this is really good data contained in this report. And there are so many other reports that are giving us quality data. How can we facilitate partnership among all these people to ensure that such data collection, management of this data, and most important, the use of this data is, encouraged to bolster accountability efforts?
That's a great question, and it's really important for all of us to work together. Efforts to bolster accountability require investments in things like routine health information systems and civil registration and vital statistics, as well as support for data analysis, especially to assess inequities. It also calls for helping countries introduce new data collection and visualization techniques, and technologies. And we also need greater country ownership with regards to measurement and accountability to ensure more context-specific multi-sectorial actions are designed and implemented. Let's not forget that Every Woman, Every Child, which began in 2010 and was added to in 2015 with the Global Strategy for Women and Children's and Adolescent Health, has as its strength its convening power and a strong support for its mandate and multi-sectorial stakeholder approach, as reflected in the commitments across sectors and issues areas of the report. As we move into the next decade of action with the added challenge presented by COVID-19, this movement is more critical than ever in championing multilateralism and in mobilizing action across all sectors to protect and improve the health and well-being of women, children, and adolescents.
Great. Thank you very, very much. And I think you raised very, very important points there. And I'm looking forward to see the dissemination of this report and just seeing, what great things are going to come out of it, even as we, rally governments and policymakers to come together and act for women, children, and adolescents. So thank you very much for all you're doing, and have a nice day.
Thank you.